glad today that we have people here who are actually interested in knowing what these conditions are and how these conditions can be prevented by performing safe work practices. Okay, so now that we understand the gravity of musculoskeletal conditions, it is important to learn from experts in the field. And we are fortunate to have with us today Dr. Nurul Nadia binti Harith from ASP Medical Group. She is a medical officer and occupational health doctor who will guide us through the introduction of musculoskeletal disorders that are related to ergonomics and how they can be prevented. Okay. But before that, I would like to invite our Executive Vice President and Chairman of the EHS Committee to share a few words on as an opening speech. So let's invite Mr. Yoshi Hong.
Okay, good afternoon. Thank you for coming to this talk. Recently, we have heard more and more cases of people having back pains. Sometimes they don't realize that it's related to the way they sit or other not so proper postures in handling, especially heavy things when they carry things or when they work. People like my height usually don't have issues, okay? People like Yong's height, then yes. Sometimes because of the chair, because of the table, then yeah, I don't know. I don't know if all of you have these issues. Maybe you know some of your friends have. So if come today, you hear from Dr. Nadia and whatever things that you have learned, maybe you can share with your friends or your colleagues or even your families who have these issues. Hopefully you gain something useful. And do give feedback to Yong and the team if there's anything that you feel that needs changes after this. Thank you.
Thank you very much, Mr. Yong. So before we start, can I gather everyone into the center of the auditorium so that we can take a quick picture first, because we want to print it out as a memorandum for our guest speaker today. So can everyone come to the front? Those from the back come to the front, fill up the front seats. Otherwise, it looks very sad in the front.
Doctor, can we have you sit in the middle?
Doctor, can we have you in the
yes.
center too?
You can change back to your seat later. You just walk for the front
come
for
take photo, quick.
Then you move back. I don't mind. Sat je.
Come here. Come to the front here. Come.
Aman, sit at the front. Aman. Front.
Depan.
Move to the front.
Yeah, very sad here. Very empty. The first row.
Haya. Ini shy row. Okay, Okay, everyone ready? Yang pakai mask nak buang mask tak? Tanggal mask. Okay, breathe. Okay, 1, 2, 3. One using iPhone.
Hello. Okay. 1, 2, 3. Okay. 1, 2, 3. Okay. Thank you.
So without further ado, let us welcome our guest speaker today, Dr. Nurul Nadia, to present her wonderful speech.
Okay, hi, good afternoon, everyone. So I think everyone is still wide awake. Anyone who is feeling sleepy today, currently, right now? No? Okay, very good. Okay, before I start, I would like to introduce myself. I'm Dr. Nadia. I'm a medical officer, and I'm also an occupational health doctor under Yosh Dosh. Okay, all right. So before I start, I would like to ask, does anyone here know what is ergonomics? Yes? Maybe anyone wants to try? What is ergonomics? It is so much more than just sitting upright. It is so much more just that to maintain your posture. Because some patients, when I talk to them, oh, doctor, my posture is not right. I'm having poor ergonomics. But ergonomics is actually so much more than that. Okay, so today I'll try to make you understand what ergonomics is and have some questions towards the end of my session. And we got some little prizes, whoever can answer it right. Okay, right. Okay, so according to International Ergonomics Association, all right, ergonomics is actually the science that actually to optimize the worker's well-being relating to the system performance. Okay, so that is the summary of everything that is written here. Okay, so we are trying to fit the worker to the job instead of just generally fixing everyone to general job. Okay, especially if that particular worker or that particular someone has underlying medical illness. Okay, that's where economics become very crucial. Okay, all right. Okay, so ergonomics actually comes from the Greek word, consists of two syllables, which is work and also law. Okay, so ergon is known as work and nomos is law, right? So it is basically the laws of work, the science of work. Okay, ergonomics is actually a medical science. Okay, behind the job that you're doing, behind the activity that you're doing daily at your workplace. Okay. All right. So today we are talking about workplace ergonomics mainly. Okay, we have different types of ergonomics, physical, cognitive, but today we focus mainly on workplace ergonomics, right? Okay, so workplace ergonomics is the science of fitting workplace conditions and job demands to the capability of the worker itself, to that particular human being itself. Okay, so generally, workplace ergonomics is about building a better workplace that is safe for the worker, safe environment. Okay, so that is workplace ergonomics. For example, if you're working in a very hot place, noisy place, will that be comfortable for you? Is it okay? No, right? Okay, because the environment also play an important role in ergonomics. Okay, there are several risk factors for poor ergonomics. I'll explain each of them. Okay, but first we go to the risk factor for ergonomics first. Firstly, we involve the worker's capacity itself. Next is the task demands. Task demands means the job you are doing, the activity you're doing, right? And the third one is your working environment that I mentioned just now. Okay, right. So for workers' capacity, we divide it into two categories, which is physical capacity and also physiological factors. All right. For physical capability, okay, like just now he said, all right, everyone is not made the same. Everyone is not built the same. Some worker is higher, taller, and some worker is just a bit shorter. Okay, so your body size also plays an important role in the job that you are doing, right? So your height, your weight also matter. For example, if you're working in a tight, confined space and your BMI is 35, for example, you're 140 kilos, will that confined space be suitable for you? You may get stuck inside it, right? All right, so weight matters also, okay? All right, next we go to fitness and strength. For example, you're working as a forklift driver. Of course, your heart condition must be perfect. Your cholesterol level must be perfect, all right? Because you're manual handling a heavy machine, heavy tractor. What happens if you have high cholesterol? Okay, you may develop sudden heart attack. So these are all playing an important role. Okay, this is all economics, okay? All right, next we look at poor health profile, those with arthritis, diabetes. Okay, diabetic patients, when they inflict wound on themselves, the wound will heal very slow compared to healthy patients. Okay, that's why if you are a diabetic patient, you're wearing a tight safety shoe, kasut ketat sangat, right? So what happens? You will develop blisters, right? And that blisters can actually turn to diabetic foot ulcer. And some patients, and I have got real patients, they had to go for amputation of their feet, of their toes, okay, because of their poor health status. Okay. All right. Next is poor work practices. What is the example of poor work practices? Not complying to personal protective equipment. If, example, you're supposed to wear a safety hat, you're supposed to wear smoke, safety boots, but you're not wearing them. Okay, so the risk of you sustaining the injury is much higher. Okay, so that is physical capability. But what about psychological factors? Psychological factors involves more around your personal habits, your knowledge, and also your experience. Okay, so usually those are always involved in complications of ergonomics. Musculoskeletal disorders are the new ones, the interns, okay, because they are not well trained yet. They are very new to the environment, so they have no experience. Okay, right. Next is the working environment that you're working at, right? So working environment may affect someone's changes of developing problems or complications. Okay, for example, your workstation layout. Okay, your table may be a bit too high, your chair may be a bit too low, you're stretching your neck, you're stretching out your hands, your arms. Okay, so the design of your workstation must also be comfortable for you. Okay, and environmental factors, extreme heat, cold, noise, and poor lighting. And I would like to add on also biological factors in environment, which means if your colleague is having tuberculosis, COVID-19, influenza, and that patient is not quarantined, will that environment be comfortable for you to work at? No. Okay, so it's not a safe environment for you to work at. Okay, all right. Okay, so next we go to task demands. Task demands are the kind of activity, the kind of job activity or work activity that you are exposed to every day, okay? Whether it involves awkward posture, repetitive motion, forceful exertion, local contact stress, and also vibration. Anyone ever heard of this nature of work before? Never? Okay, it's all right. Okay, so what is awkward posture? Awkward posture is deviations of any of your body parts from your usual position. For example, okay, you have to work overhead. You have to reach out continuously several times a day, right? You have to kneel down, kneeling. Okay, this is very awkward. For example, you have to kneel, you have to squat down for more than 2-3 hours a day, all right? Some of you may even need to do back bending forward, back bending backwards, okay? Squatting, neck bending, and also reaching. If you do this, maybe several times a day, it may not cause any complications. But if you do this continuously, not for a day, not for a week, not for years, but maybe 10 years, 15 years, all right? So it may have some health impacts on you, okay? All right? So anyone who is having any awkward posture right now? Everyone is sitting straight? Everyone is okay? Anyone who is stretching backwards ke ada? No, eh? Okay. All right. Okay. Okay, so how you can actually prevent? What are the solutions? What are the recommendations? Okay, first, if you are working or you're overreaching, okay, you can actually use tools with longer handles, okay, instead of reaching up, instead of tiptoeing on your toes. If you have to work on the ground, use a stool, okay, all right? And you have to alternate yourself between bending, kneeling, standing, squatting. What happens if you squat more than 3 hours a day? Anyone have tried it before? No? Okay, so you will develop some numbness over your gluteus maximus, okay, at the back area, okay, because you are compressing your nerve at the back. Okay, so if you don't trust me, you can try to squat yourself. Tengok apa jadi, okay? All right? Okay. Okay, that's number one. Number one is awkward posture. Okay, right. Number two is repetitive motion. What is repetitive motion? Doing the same thing over and over and over again, right? So this is repetitive motions, okay? So similar motions or actions that are repeated using the same muscles, tendons, and joint, okay? So it is also influenced by your workplace. It is considered to be highly repetitive if the time to complete a task is less than 30 seconds. What does it mean? It means that if you are working in a production line, you have to transfer in and out of the item, okay, one cycle of transfer in and out, okay, in less than 30 seconds, okay? Pick up, fill in, put back. Pick up, fill in, put back. Okay, that one cycle, you have to do it continuously, okay? All right, so that is repetitive motion. So what happens? What happens? You're doing the same, you're using the same muscles over and over and over again. What's gonna happen? So you develop some soreness over your hands, arms, okay? All right? Okay, recovery time, when you do not have adequate time to recover your muscles before you use them again. Okay. And the third, the amount of variety in tasks. Okay. So overloading on the same part of your body, specifically your muscles, the part of your muscle, can cause pain and injury towards your muscles, tendons, and joints. Okay. All right, so these are some of the common examples of repetitive motions. Okay, there are some myths or some beliefs that saying that if you type a lot on your keypad, you can actually develop some cumulative trauma disorder, okay, carpal tunnel syndrome. Okay, but mostly, actually, based on our studies, the repetitive motion of your mouse actually cause the carpal tunnel syndrome, not the repetitive motion of you typing on the keypad. Okay, all right. Okay. Next is the production operator. And so you have to leave the bread, do something on the bread, and then put it on the line again. Okay, so you're doing it more than 5,000 times a day. All right, so that is repetitive motion. Okay. Okay, so what are the solutions or recommendations? You can arrange work to avoid unnecessary motions. If you have tools, machines to help you with your job, use the machinery tools. Okay, this is what we call engineering control. Okay, spread repetitive work. I've got some patients or some employees, they're supposed to finish their task over 8 hours. Okay, start work at 9, go back at 6. But these employees, these patients of mine, they wanted to finish their work before lunch so that they think that they can actually go back home earlier. So what they do, instead of spreading 8,000 motions of muscle over 8 hours, 9 hours, they do it in 4 hours. All right, and the next day they MC lah, sakit tangan, bengkak, right? Very, very common. So please spread out the repetitive work over the given hours, okay? Because to do a certain task, to do certain tasks in the work activity at your workplace, everything has an ergonomic era, which called, they have ergonomic risk factor assessment, okay? Okay, next, which is very, very common, is forceful exertion. What is forceful exertion? Forceful exertion is when you force yourself to actually carry, push, pull heavy loads more than whatever that you're capable to. Okay, I'm not sure how much loads you are handling here, but I've got some patients from other factories. They are handling about 1 ton of load. Okay, it's very, very heavy. Of course, they are using machines as well. Okay, but to carry loads, to handle loads, you must have a proper technique. How to lift the load up, how to put it down, how to push and pull properly without hurting your back. Okay. All right. So the amount of force exerted when you're moving all these heavy items depends on the load itself, how many kilos, okay, the grip, how well you can actually grip the load, okay, and the length of time means how long you're actually carrying that load. All right, number of times, how many times you have to carry the load in a day, duration of your task, and also your body posture during handling of the load. Okay. Okay. Anyone ever heard of the PowerPoint? Not the PowerPoint PC yang you buat kerja tu, no. The PowerPoint of safe handling. Everyone ever heard of that? No. All right. Okay. I would actually need a volunteer actually. Siapa nak jadi volunteer? Anyone volunteer? Anyone would like to volunteer? Can I have one macam box tu? That box, that one, yeah. I know the other, the below it. Yang sekejap. One volunteer, anyone? Okay, pick a name. I think you guys know your stuff. Sui? Shui? Yusui. Can I have a Yusui here? Thank you very much, Yusui, whoever you are. Okay, ergonomics. I really cannot explain ergonomics based on slides only. I will need to show on how to safe handle all these things. So I really need Yusui to help me. Oh, not feeling well. Okay, it's okay. We have another volunteer. Thank you very much. Thank you very much. Okay, all right. So how do I call you? Muhammad Aman.
Aman.
Aman. Okay, all right. Okay, Aman. Okay, so Aman, I will need you to, okay, for example, this is example 20 kilos or 50 kilos of weight. Okay, so how do you usually carry these heavy loads? Macam mana Aman selalu angkat? Macam tu, alright? Okay, so the area that Aman is actually holding this load is known as the green zone, the excellent zone, the safe zone for Aman to carry this load. This is very, very ringan, so you cannot actually appreciate it. But example, Aman, try to stretch out this load all out. Okay, 20 kilo. Okay, so do you feel comfortable tak? Even this posture is not comfortable. Okay, so if what Aman is actually doing is he's carrying the load out from the safe zone. Okay, so if example this is 20 kilos, this can actually felt like 30 to 40 kilos because this is not safe. Okay, now Aman, try to lift up the load over your head. Do you feel comfortable? No, all right. And now try to lift it below your knee and walk. Walk in front. How do you feel? Weird, right? Okay. So what Aman is doing, he's not only handling the load at a not safe place, but he is also walking in an awkward posture. Can you see? So this is poor ergonomics. So if Aman keep on doing this for 3 days straight, so what will happen to Aman after 3 days? MC lah, kan? Why? Why? Tak aman. Okay. Tak aman is of course his jiwa tak aman. And of course of back pain lah. Okay. After this will be very interesting. We will go into specific illness related to specific motions and everything. But before I go there, I will need you guys to really understand what is ergonomics. Okay, so this is what ergonomics. Ergonomics is not just about sitting straight, make sure your leg touch the floor. No. Okay. All right. Okay. All right. So, Aman jangan pergi dulu. Okay, so any other volunteer selain pada Aman? Aman juga? Anyone want to volunteer other than Aman? Aman, pick a friend. Pick a friend. Panggil kawan. Okay, Adam. Adam just diri je. Adam tak payah naik. Adam diri je, Adam. Okay, Adam. Gambar atas ke gambar bawah? Which of these two diagrams is the correct method to lift up heavy load from the ground? Atas ke bawah? Atas. And why is that? Use the leg to lift. Okay, the answer is correct, but the explanation is not right. Okay? All right, I'll still give you a present at the end of the talk. No problem. Apa nama tadi? Adam. Okay, Adam, I remember you, okay? But the clear explanation for it is because, tengok, the first diagram, the above diagram, look at how this worker is actually maintaining his back posture comparatively to the worker at the lower diagram. Look at how he bends and flexes his back. Nampak tak? Okay, so that's the reason. Not because of his using his leg, his kaki, no, okay? Because cumulative trauma disorder or slip disc or prolapse invertebral disc is a preventive disease. It's all about prevention. As long as you know how to prevent it, okay, taking good care of your back, okay, so it'll be very, very beneficial for you. Okay, all right, good job, Adam. Okay, now Aman. Okay, you have to show your friend. Let's say put this on the ground. Put it on the ground. Okay, there are two ways how to carry heavy loads. Okay, the first method is by, okay, just now you know where is your PowerPoint area to safely carry heavy loads, right? Okay, so the first method is you go down, all the way down. You go all the way down. Okay, carry the load, put it at your PowerPoint. Yes, and then you raise up. Yes, okay, that is option 1. Okay, option 2, put it down again. If let's say this is 50 kilos, very, very heavy, sangat berat. Okay, so what you can do, you support it with your thigh, your femur bone. Your femur bone is one of the strongest bone in your body. Selain pada gigi lah. Okay, right. So what you do, Aman, you put down one of your thigh on the ground. Okay, and you support this load on your thigh. And use your other leg to push yourself up. Something new, okay? All right. But throughout the whole process, give himself an applause. Baguslah Aman ni. Okay, so after this Aman, I need you to teach your colleagues the correct way. Kalau nampak mereka angkat tak betul, cubit. Okay, alright? Okay, alright. So there are two methods. One is you carry it in between your thighs to your PowerPoint and you get up. Secondly, you support with your thigh. Okay, so the wrong way to carry any heavy loads is the second diagram. Put it back on the floor. Okay, Aman, stand up a bit. Okay, this is the wrong way. Never do this. Okay, tolong bengkok angkat. This is the wrong way. Tak boleh buat. Cannot do. Okay, all right. And I really have patience from other factories, other companies. They did that. Okay, because this is very, very light, 1-2 kilo. But when you're dealing with 100 kilos, 200 kilos, kan, you can, of course, snap your back in a split second and then you are diagnosed with certain illness, okay? And then you have to focus on curing the disease when actually you can actually prevent it, okay? All right? Okay, all right. So thank you. Thank you very much, Aman. Okay, thank you very much. I hope everyone is clear, kan? Ada demonstration. Because again, economics is not only about slides. You won't learn so much. You won't understand. Kan? You have to see. Kan? Okay. All right. Okay. So how many of you are actually pushing and pulling heavy loads? Ada tak? How often do you do this? Anyone in the production area? Anyone? Ke tak? Ke everyone is just working desk job? Okay lah, maybe either, but malu nak angkat, so I'll just explain. Okay. If there is anything at all that you would remember from my talk today, yes, lain semua lupa, tapi remember one thing. When you are pulling or pushing, do not twist your back. Okay, can you get that? Okay. Do we have a trolley here? Tak ada. Tak ada. Okay, it's alright. Okay, so when you're pushing, for example, you're pushing a trolley, right? Okay, and let's say the trolley is about 100 kilos, 200 kilos. Okay, what you cannot do is push and twist. Can you get that? Or pull and twist. Can you get that? And why is that? Why? Why twisting is prohibited in handling heavy loads? Why? Anyone wants to answer? Ada. Okay, all right. Okay. Okay, because I would need you to understand that this is your spine, your vertebra. Can you get that? Bayangkan, eh? This is your lower spine and this is your upper spine. In between of your spine, there's a disc. So if you're handling heavy loads and you twist, what will happen? Slip disc. Okay. All right. I'll explain further on slip disc later on. Okay. But main thing that I want you to understand is that no twisting during pulling and pushing. Okay. Okay, what is local contact stress? Next, local contact stress is any pressure points resulting from pressing against hard or sharp surfaces. Okay, for example, you're working with hand tools, hard tools, you have to use a lot of pressure. Okay, all right. So this contact stress can actually irritate your local tissues, your muscles, and then cause some inflammation around that particular area. Okay, so certain areas that are more susceptible because of the superficial nerves, tendons, blood vessels. Superficial means they are close to the skin. Okay, all right. So most common areas are fingers, palms, wrists, and forearms. Okay. Okay, so this is the example of local contact stress. Okay, next. I'm not going to go very detailed in vibration because I'm sure no one is dealing with a drilling machine here, okay? All right. But I'll just explain superficially. Vibration can occur in two categories. One is locally, for example, using just hand, arm, tool vibration. You're just using the machine that is vibrating. The other one is whole body vibration. Whole body vibration means you're sitting in a tractor. So from head to toe, everything is vibrating. Okay, but since you are not involved in it, I shall not go any deeper. Okay, so this is the example that I'm talking just now. Okay. All right, so this is the interesting part. We go to effects of poor ergonomics. So if you practice poor ergonomics, you will get complications of ergonomics, which mainly are the musculoskeletal disorders or musculoskeletal disease, or known as cumulative trauma disorder. Okay, there are different names to it. Okay, so this MSD includes sprains and strains of your muscles, injuries to your muscles, your ligaments, your bones, your tendons, your discs, right? And also your also certain tendons or the part of your joints. All right, so this MSD, musculoskeletal disorders, can occur in two ways. One is acute cumulative trauma disorder. It means that it occurs acutely, very, very fast, in the blink of an eye. Okay, you are carrying heavy loads, then suddenly you hear a pop sound over your back. Okay, so that is sudden and acute. But chronic cumulative trauma disorder, if you do a lot of overhead reaching, okay, one day you're working about 5 hours, 6 hours, you're putting things over your head. Okay, so over time, these actions of yours, okay, will lead to cumulative trauma disorder, or you will have some gradual wear and tear of your shoulder slowly. Okay, it's not like one day you're doing it, it's terus, oh doctor, saya punya shoulder patah. No. Okay, we talk about months, we talk about years. Okay, right. And of course, treatment is the first stage, is of course preferred. I myself will always encourage prevention. That's why ergonomics is very important. You understand what are the risk factors like vibration, environmental factors, local contract stress, excessive force, how to handle loads properly. All right. So you prevent them before it even happen. Okay. All right. So of course, in more advanced stages, medical intervention is needed. Okay. All right, so stage 1, usually patients, employees will present with body aches. They feel tired. When they start to do their work, especially in that shift, they start feeling discomfort, pain. All right, but stage 1, the pain is always reversible. So when you go back home, the pain is no longer there. That is stage 1. I think something is a bit wrong with the slides, but bear with me. Stage 2 starts early in work shift. This stage 2, usually the pain, the symptoms will persist longer. Okay, usually it will persist for a few days, and then when you rest, and then the pain will go away. But stage 3, the symptoms persist even at rest. This is where medical intervention is needed. Okay, so the main idea of these slides is whenever you feel discomfort or pain at certain parts of your body, whenever you're doing certain tasks or job, okay, seek medical attention at that particular stage itself. Don't wait until even when you're at home, you're sleeping, you cannot sleep because of the pain. That is a bit too late. Okay, all right. Okay, so these are the common musculoskeletal disorders. All right, anyone ever heard of plantar fasciitis before? It's about the pain over the back of your heel whenever you stand sangat lama, you're standing for 10 hours, 12 hours at work, and you started to feel, oh doctor, bila I berdiri kaki I sakit lah. Anyone ever heard of this? No, so everyone is very good here. Eh? Okay, everyone ever heard of rotator cuff tendonitis? What is rotator cuff tendonitis? Yeah, everyone is tapping their shoulder kan? All right, okay. So rotator cuff tendonitis is also known as frozen shoulder ke macam tu lah. Okay, so they cannot move at certain angles because of the pain, because of the inflammation of the tendons, right? Okay, all right. Today I will not focus on every illness lah. If I do that, I think tomorrow pun kita still kat sini. So I'll focus on the very common ones. Okay. Okay. First, the most common case in ergonomics is prolapsed invertebral disc, also known as slip disc, also known as herniated disc. Okay. All right. Okay. So it's very fascinating, or say kelakar a bit when sometimes when I see patient will be like, oh doctor, I semalam MC sebab I ada slip disc. Then I'm like, oh, how do you know you have a slip disc? I nak tidur, I sakit lah. So no. Slip disc is not like that. Slip disc is not because of pain, sikit macam tu, no. Slip disc is actually a very severe medical condition. Okay, it's in very severe cases you need to go for surgery because when it impacts your nerves, you can't even walk. Okay, that is slip disc. And of course, slip disc is not about doctor tulang belakang saya pecah. No. Okay, slip disc is not about your bone. Slip disc is about the disc in between your vertebral bones. Okay, all right. Okay, so lepas ni balik, oh, I know about slip disc already, kan? Okay, right. So what happens is that usually sleep disc is very, very highly associated with your posture and also during manual handling of excessive load, excessive force. Okay, so when you exert high pressure over your back, like I mentioned just now, especially when you twist, okay, the mechanism, so you're actually pushing the nucleus EC of the disc itself to propel out. Okay, all right. So when it goes out, herniated out from its sac, that is what we call slip disc. Okay, all right. So you can see in that photo, okay? When it slipped out from its normal cavity, it impinged on the nerve. So that's why some patients with slip disc, they feel like there's a burning sensation over their leg. They feel weak, they feel numb. Okay, and some may even not be able to walk, not because of their bones pecah, no, not because of the backbones are broken, no, it's because of the nerve being impinged, the inflammation at that particular area. Okay, all right. Okay, so the symptoms, very common symptoms, pain and numbness, most commonly on one side of your body, of your leg, lower limb. It will extend to your arms or leg. It can also happen not only at your lower back, but also at your upper back. But upper back, you usually associated with numbness and weakness of your arms. But if it's at your lower back, associated with numbness and weakness of your lower limbs, kaki. Okay, all right, okay, all right. So actually, the pain will worsen at night or during movements, during ambulation, even by moving your legs, okay? And like I mentioned just now, some patients, if the nerve is really much affected, it can also cause muscle weakness, can't even walk, can't even stand, okay? All right, so to diagnose a slip disc is not merely just by saying, oh doctor, semalam I angkat benda berat, I ada slip disc, hari ni I dah okay. No, not like that. So diagnose the slip disc, even x-rays, some x-rays can't even identify the slip disc because x-rays can only see the bones. You cannot see the soft tissue, the disc. So this is MRI. MRI is the gold standard of diagnosing a slip disc. Okay, so you can see the normal disc and the herniated disc. It will bulge outside. Okay, so this is slip disc. Okay, all right. Okay, so what are the risk factors to slip disc? First is weight, obesity. If you are pre-obese, obese, overweight, of course, it is a risk factor to develop slip disc. Second is genetics. Okay, if your parents have slip disc and then you have some autoimmune disease, okay, from genetic, so it can also be a risk factor for you to develop slip disc. Smoking, of course. Why? Because it will lessen the oxygen supply to your disc, not only to your disc, your whole body. Okay? So your disc can actually break down more easily, right? Frequent driving or frequent sitting, or you sit for too long. Okay, example, if you are handling a tractor, vibration, poor posture, sitting on the tractor for more than 10, 12 hours, okay, that is also a risk factor. Even being sedentary itself can also be a risk factor. Okay, so exercise, walk around, do some brisk walk, jogging, all right. But work-related, why I'm highlighting the work-related is because we talk about ergonomics today. So repetitive lifting, pulling, pushing, bending sideways, twisting can increase the risk of slip disc. Why am I repeating the twisting? It's because I have two cases just recently, about 1 and 2 months ago. That patient of mine, he was handling a 1 ton of cargo, but he was using a automatic pallet. Okay, but the reason why he developed a slip disc because he was pulling it, although it's automated, but towards the end of the room, he has no more place to actually move, so he twisted, but he didn't let go of the cargo that he was actually pulling. So he twisted, and that thing was not on break yet, stop yet. So he developed the slip disc. Okay, and until now he is under treatment under hospital. Okay, that's number 1, slip disc. Next is carpal tunnel syndrome. Anyone is familiar with carpal tunnel syndrome? No? Okay, so carpal tunnel syndrome is actually your compressed nerve over your hand, right? So when your nerve is actually being compressed, you will develop numbness, tingling sensation, weakness in your hand and your arm. Okay, so this is carpal tunnel syndrome. Okay, so usually you feel tingling, sensation, numbness over the half part of your hand. It's not the whole hand, it's over the median nerve supply. It means half of your thumb, from your thumb to the half side. Okay, it's not all, right? And sometimes if your nerve is badly affected, you'll feel like an electric shock current. Okay. And also, some patients may even come with weakness of their hands and they start dropping objects. When they hold something, they will start dropping objects. Okay, so that is carpal tunnel syndrome. Okay. Right, so there is a test. I see some of you are already doing the test without me even mentioning it. So I think you're all very, very well informed. Anyone wants to be a volunteer for this test? Again, I really don't know how to explain ergonomics with just slides. It's better if I have someone to show it. Anyone wants to do the test? No? Just come up here. And then you can tell your friends after this. All right, okay. So we have two types of tests, all right? We have the Fallon test and also Tinel test, okay? Tinel test is you tap on the area, you tap on the nerve. So what will happen if you tap on the inflamed nerve? You'll feel the pain, you'll feel the electric current shock, zoom, 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 over the nerve supply. That is Tinel test. Anyone feeling any sensation? I want everyone to tap your hands now and check. Anyone feeling any electric shock running through their hands? If ada, come and see me, yeah? Tak ada, so far all good? Okay, all right. Next, we do the Fallon test. Fallon test macam mana? Oh, pandai lah. Okay, not macam ni, macam ni. All right. Okay, so anyone feeling any electric shock currently? Tak ada, semua okay. Oh, very good ergonomics, yeah, good, good. Okay, very good. Okay, give yourself an applause. All right, okay. Next is risk factor for carpal tunnel syndrome. I would say that most of my patients that I see for carpal tunnel are mostly female. Okay, female, they are more prone to get carpal tunnel compared to the male because of their hormones lah. Okay, anatomic factors. Let's say if you had an injury before, had an accident before, of course, that area becomes sempit and then you can get carpal tunnel easily. Okay, nerve damaging conditions. If you have diabetic neuropathy, okay, you have diabetes, not well controlled, diabetes affecting your nerves, okay, and of course you can have all these nerve issues also affecting your carpal tunnel area. Okay, rheumatoid arthritis also the same. And some medications, like very, very high dosage of medication, very strong medications, macam anastrozole, it's the anti-cancer medicine. It can also, it is also a risk factor to carpal tunnel. Okay, and it is very common in pregnancy. Okay, I've got a few patients also, I think 2 patients, that they had carpal tunnel, tangan sakit, bengkak, because of fluid retention. When you're pregnant, especially the ladies, okay, you have fluid retention, so your fluid will accumulate over that particular area. So that's when you have carpal tunnel. But you don't have to do anything. Please don't take any medicine when you're pregnant, okay? It's very not healthy for your baby. It will go away. It will go away after 2 to 3 months of delivery, okay? Work-related. So this is where the focus is at. Working with vibrating tools or assembly line that requires prolonged or repetitive motion may create harmful pressure on the nerve, especially if you're working in a cold environment. Okay, so that is why I explained about repetitive motion, vibration, so that you understand what is it before we go to all the illnesses. Okay. Okay, next, trigger finger. Anyone had any history of trigger finger before? Trigger finger is like a stuck finger. So you flex your finger and then you are unable to extend it. Anyone has this issue before? Yes? Pernah? 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 Then what happened? Okay dah? Few seconds. And then did you take any medications for it? Didn't. All right, okay. So trigger finger is actually very common as well. You may not know it unless you experience it. Tapi tak nak lah sampai the experience baru you want to know about it, right? Okay. All right, so trigger finger happens when the tendon that controls your finger cannot glide smoothly. So it's stuck. The finger is stuck. Tak boleh nak flex, cannot extend properly. Okay. This may occur if your tendon becomes swollen, if there's a lump. Okay. Okay, so the symptoms are stiffness, especially in the morning, popping or clicking sensation of your finger, mostly affected your sometimes index, sometimes thumb, sometimes ring finger. Okay, you can feel like a tenderness, like a bump over that particular area. Finger catching or finger locking. Now suddenly you cannot extend. Suddenly your finger is locked in certain position. Okay, all right. So again, risk factor is more common in women because of the hormones. Underlying medical condition, diabetes or rheumatoid arthritis, and work-related is involving repetitive motion. Okay, right? So any of you who is doing a lot of repetitive motion at work, okay, whenever you feel discomfort over your fingers, over your hands, okay, so you can actually seek for medical advice. Just see a doctor, tanya doctor why is this happening? Okay, maybe a doctor can actually prescribe you with a band, with a splint to actually prevent it from worsening. All right, okay. But please don't see a doctor saying that, oh, doctor, I have trigger finger. No lah. You see a doctor say that you have this kind of pain. What is this? Okay, like I mentioned, not only that condition is caused by your work, it can also caused by the risk factor, your genetic factors, your risk factor, your identity, your gender. Okay, right? Okay. Okay, next is rotator cuff tendinitis. Just now I heard that someone actually said that it's very familiar with rotator cuff tendinitis. Okay, so what is rotator cuff tendinitis? Now everyone is touching their shoulder now. Okay, what is it? Okay, so rotator cuff tendinitis is actually inflammation of a group of muscles that actually move your muscle around. It does not only involve one muscle, it involves 4 muscles: supraspinatus, infraspinatus, teres minor, and one more is subscapularis. Okay. All right, so we go directly to the work related because it's very important. Tendinitis, or rotator cuff tendinitis mainly is affected by a lot of overhead reaching. Okay, for example, if you have to lift, you have to pick up an item, lift overhead for multiple times a day, or overreaching, overhead. Right? It's overhead. The term here is overhead. It means above your head. If you are picking up something just around your neck area, shoulder area, still should be fine. But if you are overreaching above your head, okay, that's when you will have you'll be at risk for developing rotator cuff tendinitis. Okay. All right. So, and also, of course, it is age related. When you get older, you get osteoporosis. Some of your bones may not be as strong as before. Okay. So your tendons become less flexible and you are predisposed to have this kind of medical condition. Okay. And also certain medications such as antibiotics, corticosteroids, steroids, aromatase inhibitors, anti-cancer medications. Okay. This may also be a risk factor to develop this kind of illness, right? Okay, so how do we diagnose rotator cuff tendinitis? We have 2 methods. Anyone is familiar with these methods? No? Okay, so maybe we can do it together. One is you lift up your hand macam ni. Try. Why don't we try? Man tahu any one of you have rotator cuff tendinitis undiagnosed? Okay, so far it's okay. All right, then you move atas, bawah, try to move it up and down. Try to move it around. Oh, very good lah. Semua okay lah, huh? Okay, very good. Okay, next we go up. Right, and we go full flexion, extension. Okay, very good. And then we go round. Any pain so far? Oh, okay. No pain, eh? Okay, anyone dengan a lot other pain, come and see me lah, we'll check it. Okay, all right, very good. Okay, so next we go to tennis elbow. Tennis elbow is inflammation of your elbow joint. Okay. Okay, so okay, tennis elbow will occur if you overuse the tendon of your elbow. Okay, you have to do repetitive job, awkward posture, okay, for a prolonged period of time. So you have tendinitis, inflammation of the tendon over your elbow. Okay, so this is what we call tennis elbow. Okay, it is known as tennis elbow because previously during the early days, during early medical days, this usually occurs in tennis players. Why? Kan, yeah, very good. So when you're using a lot, they smash, or I don't know how they use the ball and they beat up with their elbow, kan, right? Because it's a repetitive motion of their elbow, so it's known as tennis elbow. What it actually means is inflammation of the tendon of your elbow. Okay, all right. So how this pain occurs is because of tiny tears, repeated tiny tears of your tendons, which actually then lead to inflammation. And then over time, it will cause pain over that particular area. Okay. Okay, so usually patients will feel the pain when they want to do a handshake or when they're doing rotation. Turn a doorknob, okay, hold a cup of coffee, okay, anything that involves the muscles from the elbow region. Okay, all right. So why am I emphasizing on the signs and symptoms? Because that you can actually identify. Let's say if you started to develop all these symptoms, and then you remember, oh, that day Dr. Nadia came, or she told if you having difficulty in turning the doorknob, or maybe I have this kind of illness, I must go and check. Okay, all right. It's not important that you know what is the diagnosis. Diagnosis is doctor jobs. We are paid to diagnose patients correctly. You don't have to worry about that. But as a worker, you need to understand what are the signs, symptoms, when you should seek for help. Okay, all right, okay. All right, so tennis elbow, risk factor is age, all right? Most common, it can also occur in young adults. Surprisingly, it does not only occur in 40, 50 years old elderly patients, as early as 30 years old, okay? All right, playing certain sports, especially when it involves a lot of awkward posture, back smash lah, back flip lah, okay? So all these can actually risk factor to tennis elbow. And work related, of course, involve repetitive motions of the wrist and the arm, okay? So most of the occupations that are at risk factor are the plumbers, the painters, carpenters, butchers, and also cooks, okay? And of course, smoking, being obese, and take certain medication, especially like anti-cancer medication, methotrexate, can actually predispose to this kind of illness. Okay. Okay. So far, any questions about any of the medical illnesses that I mentioned related to ergonomics just now? Ada tak? So far, all okay. So far, all good, eh? Okay. All right. Okay. Next. Okay, next is how do we prevent all this musculoskeletal disorder disease? Okay, so if you are stressed, usually you listen to music. Can you listen to music? You watch games or you do whatever that can actually elevate your mood up. Okay, you do anything that can actually deviate your thoughts from the stress. But when your muscles are stressed, what do you do to them? Sleep it off? Most of us sleep it off, kan? Right, but actually, there's an exercise, we call it a stretching exercise that can actually help to relax our muscles, okay? In more advanced countries like USA, all right, especially in the production area, okay, every 2 hours, they would actually play like a 20 seconds of music, and everyone will need to stop doing whatever they are doing, and they have to do stretching exercise. That's very, very good. That is one of the best prevention of ergonomic musculoskeletal disorders. Okay, but of course we are not practicing here yet in Malaysia, but we can actually learn to do some stretching exercise. Okay, right. So let's do this together. Okay, before we go. Okay, first is neck rotation. But before we do this, I need everyone to sit up straight. I need everyone to say ergonomically perfect. Ergonomically perfect means I need your back to be at the back of your chair. I need your hands to be on your leg. Relax. I need both of your legs to be on the ground. Okay, and please don't slouch. Because I realize that some of you would like to sit on one side of their body. Okay, so you're putting one weight on one side of your body. Also, the posture is not good. It will affect your back posture. So sit straight. Put your weight on both of your buttocks. Don't put on one buttocks. Okay, when sitting on one side, even I myself sometimes I tend to forget. But when we sit on one side of our buttocks, we are putting all of our weight on that one particular side. Then esok mulalah sikit belakang. Okay, right. So first we go for neck rotations. Okay, I'll need you to keep your head upright. Gently turn your head from side to side. Gently. Janganlah kasar, gently. Gently, left to right. As you turn your head, try to move it past your shoulder. Okay, first, left to right, then past your shoulder. Stretch it past your shoulder. At the back, janganlah kacau kawan, belakang je. Okay, and then you hold for 5 seconds. Hold for 5 seconds. 1, 2, 3, 4, 5. The other side. 1, 2, 3, 4, 5. What's happening? Okay, and then you can repeat 2 to 3 times on each side. Okay, today I'm just showing. By tomorrow, I want everyone to do this. Do this within yourselves. Okay. Okay. Next is lower back rotation. Okay, while seated, cross your arms over your chest. Grab your shoulders, rotate your upper body from your waist, turning gently, from left to right. As far as you can. As far as you can. As far as you can, maknanya you turn as much as you can. Not like as far as you can like that, no. It's as much as you can. As much as you can. Do it properly to your friends. If your friend is turning left, you turn left lah. Your friend turn right lah, you turn left. Okay, and then you hold for 5 seconds. Okay, all the way stretching to your left. 1, 2, 3, 4, 5. And to your left. 1, 2, 3, 4, 5. Okay, you can repeat it 2 to 3 times. Okay, comfortable? Okay, next we do ankle stretch. Macam mana ankle stretch? Leave your ankle clear of the floor. Flex and extend your ankle. Macam you tekan break kan? Okay, and then repeat 10 times. 1, 2, 3, sempit 1, 2, 3. Okay, when you repeat, this is 1. So it means you flex and extend, flex and extend. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, kaki sebelah. 1, 2, 3, 4. You should feel like there's some stretches of your muscles, then you're doing it right. If you don't feel it, then not so right lah. Okay? Alright. Okay, good. Next we go for torso stretch. Torso stretch is you lace your fingers together in front of you with your palms out. Take a deep breath in and stretch your arm as high as you can. Yes, and then as you exhale, you sweep them back down. Okay, we do it one more time. Inhale. And exhale. Okay, stretch it out. Okay, so you can repeat a few times also. And lower back stretch. You stretch. So you sit straight, your feet together, put your feet together, put your palm of your hands at small of your back. You lean back over your hands. And then you can feel your back is stretching out against your hand. Some of you will feel like, kat belakang. Okay? Okay. Okay, but do it gently. All this exercise, you must do it gently, okay? I don't want some of you to come and see me, oh, doctor, I did your exercise and then now I hurt my back. Tak mula. Okay. Okay, next is shoulder shrugs. This is very important, especially when you are dealing with you're facing the PC kan, for 8 hours, 10 hours. Okay, and then some of you are like this for a long period of time. So you do shoulder shrug. Okay, shoulder shrug. You raise your shoulders. You raise your shoulders towards your ear, squeezing them as hard as you can. This may look funny, but when you do them, they are actually very, very much relaxing. Press as much as you can. Squeeze it against your ear. Wow, I can see some are really relaxing. Press it against your ear. Squeeze it hard. Okay, all right. Okay. Next is forearm stretch. Okay, forearm stretch is very important to those who have repetitive motions of your arms and fingers. This is all other clinical evidence. All right. Okay, so forearm stretch, you sit with your elbows out and palms together. Slowly rotate your palms down and you need to feel the stretch. So you hold for 5 seconds. Slowly lah. Slowly. Okay, all right. This one is very simple. This may look very simple, but it have benefits, especially when you are doing a lot of repetitive motion of your wrist. Kan you do a lot of mouse, you pakai banyak mouse, you're typing a lot. Okay, all right. Some of you are praying, I see. Okay, all right, okay. Wrist circles. Next, wrist circles. 3 circles. Make circles with your hands and the clockwise. This is no, not driving. Not. Okay. Circle. This is very good for carpal tunnel prevention. Okay. All right. So you repeat 10 times, left side, and then you repeat 10 times, right side. Okay, very good. Then next is for your, if I can actually record you guys from up here. Okay, next is your eye breaks. Eye breaks. Okay, because most of you are dealing with a lot of computers, okay? Okay, so this is a very important rule. I want you to remember the 20-20-20 rule. Everyone ever heard of this before? Are you guys practicing it? No, why? Very difficult to remember. 20 minutes. Yeah, I guess that some of you may not be able to remember every 20 minutes, but what I would advise my patients sometimes is maybe every half an hour. Half an hour is like lagi senang, easily to remember, okay? So every half an hour, maybe you can just look away from your PC for about 20 seconds. You don't have to go out. You don't have to go to the canteen, to the bathroom. No, it's only for about 20 seconds. Because it is clinically proven to relax your eye muscle, okay? Because when you're looking at your PC, you are actually constricting your eye muscle, your eyeballs, to look at each word of your PC, to read the words on your PC. You actually need to contract your eye muscle, your eyeball. Okay, so when you look further away, you're actually relaxing your eyeball. Okay, all right. So that's the science behind it. So if it is possible to do the 20-20-20 rule, practice it. Okay. All right. So this is the guideline for whatever that I've told you just now. Okay. All right. So before you go, I'll need you to know that this is the perfect guideline of how you should sit at work. Okay. First, your monitor should be directly in front of you, and the top of the screen, your computer screen, okay, must be on your eye level. Okay, this is the perfect ideal way. And then you must be seated an arm away. An arm away means from your torso, your body to the computer is about 1 arm away. So it's the perfect ideal recommendation. Okay, right. Next, your shoulders and your back must be relaxed, straight up, straight against your back. Don't slouch. Don't raise your shoulders. Okay, if you want to raise your shoulders, do during the exercise when you do your shrug shoulders exercise. Okay, all right. Then keep your arms bent in an L shape. So for your arms, for your elbows, it is very interesting that your elbows, the neutral position for your elbows are in an L shape. So this is a neutral position. Okay, all right. Okay. All right. So straight with your hips back on the chair, and then again, like I mentioned just now, please do not sit on one side of your hip, one side of your buttocks, okay? Because you're putting all your 60 kilos, your 50 kilos of your body weight on that one side of your hip, okay? All right, so make sure that you're equally distributing your weight on both of your hips, okay? And ensure that your feet are both on the floor, your feet are flat on the ground, knees are in line with your hips, okay? And adjust the height of your chair if you need to. Ensure your keyboard is close, directly in front of you. And leave about 5 to 6 inches for you to rest your wrist. Okay? All right, so take photo ke apa ke, this is the perfect ideal recommendation for your working design layout. Okay? All right, so far, any questions? So far, all is good. Tak ada seorang pun tidur, Very good. Very, very good. Okay, so far, any questions? Anything that you want to ask me before I ask you questions? Before I go, I would like to ask you questions, so that I know that whatever I say today, some of it masuklah sikit. So I'm happy. Then I can go back home and sleep. Okay, before I ask questions, anyone would like to ask me any questions? Anything? About ergonomics lah, anything?
You can raise up your hand if you want to ask questions.
Yes.
Yeah. No question.
Tak jadi. Okay, then I'll start asking questions then. I think we have another 3 more bags, kan? I have 3 presents for 3 volunteers. Siapa nak volunteer? Anyone? Nak volunteer? Okay, very good. The first question. No, I like Vitrox. They're very, very sporting. Okay. Ergonomics is the science of A, B, C, or D.
D.
Designing the job to fit the worker. Correct. Correct. So you were not sleeping when I thought that just now. Okay, who wants to answer the second question? As long as you didn't sleep throughout my whole talk, you will be able to answer. Who would like to answer the second question before I turn to the next slide? Anyone would like to answer the second question? It's okay, just raise up your hand. Tak apa salah pun. It's okay. Anyone? That guy over there. Very good lah. Okay, next question. Which of the following is an example of an ergonomic risk factor? A, neutral postures. B, rest. C, repetitive motion. D, personal protective equipment. So which of these?
The answer is C.
Repetition. Betul, correct. Thank you for paying attention. Okay, next question. The last question is the easiest. I promise you it's the easiest. So who would like to answer the last question? Cepat, left one je. Yes, all right. Thank you very much. Which of the above diagrams is the correct method of lifting?
B.
Correct. The answer is B. This one kalau salah, I sedih lah. Ada demo just now. All right. Okay. Thank you. Thank you very much for joining my talk today. So before I end again, do you have any question for me? Yes. Yeah, please pass the mic. Siapa nak ask question?
Hi.
Hi.
How does sciatica? Do you know sciatica? Yeah, the pain in the nerves. How does that happen? Because I had that before, but I was not sure if it's sciatica or something else.
Okay, sciatica is actually your lower nerve impingement. This is quite detailed, medical detail already. Sciatica is also a type of prolapse disc, but what happened is that the nerve, usually it's at L5, S1 level, the nerve become impinged. So, for example, when your nerve is impinged, it become inflamed, so you can feel like an electric current all the way down your leg. But the difference between sciatica and prolapse invertebral disc means the disc is out. But sciatica may not only because of PID, prolapse invertebral disc, it can be due to other illness as well. Sometimes the joint at that particular area degenerate. The joint space become narrowed. So when the narrow space impinge on your nerve, that's when you have the sciatica pain. Sciatica pain, usually you need to take nerve medication rather than normal painkillers. So how did you manage your sciatica pain? Yes. Radiate the whole leg. Correct. Did you go for any physiotherapy? Medicine for it. So now you don't have the pain anymore. Okay, so sciatica is all about nerve impingement lah. Okay, all right. Very good question. Very medical related. Okay, any other question?
Hi, this one is a bit unrelated, but I have a confusion on the correct posture when we sleep. Because I've heard somewhere that we need a thinner pillows, and I heard somewhere that we need to raise our legs a bit. So actually, what is the correct posture when we sleep?
No. Okay, all right. So this is based on international guidelines of ergonomics. Okay. When you sit, you really have to make sure that both, like I mentioned just now, your weight are well rested on both of your hips. Okay. If let's say you would like to have some cushion, make sure that cushion is well balanced between your two hips.
Tidur.
The correct posture was sleeping. Oh, sorry. Oh my God, I heard sitting. Yeah, sleeping. Correct posture was sleeping. How do you sleep again? Yeah, I will need to understand how do you sleep before I
Because
can.
before this, I've experienced a bit of back pain.
Mm-hmm.
So what I did was I put pillows under my legs.
Mm-hmm.
So I find it a bit comfortable, but
Okay.
I don't know if it is a correct way to do it lah.
Okay, all right. Okay. Sleeping is a bit deviated from ergonomics at workplace, but it's also a type of ergonomics. Okay. What you can do is you have to maintain the posture of your back. Okay. Back care is very important. Okay. For you to develop that pain during your sleep, okay, it means that during the day, you are not maintaining the posture of your back, right? Okay, what you are doing, elevating the back, putting pillows on the back, that is already curing. It's not prevention already. Okay. So, in some patients, when they have like heart disease, kidney disease, they will need to sleep upright a bit. Maknanya tidur tinggi sikit, okay? But if you do not have any medical illness, one pillow is sufficient for you, for your neck. You'll be surprised how your neck can actually affect your lower back. Okay, all right. So you can use one pillow supporting your neck. Make sure the pillow is not too hard or not too soft. All right. Usually, when you have back pain, again, it's because of your posture during the day. Putting a pillow at the back, because we have some curve at the back here, kan? So some patients can actually benefit by putting some comfort over that lumbar lordosis, we call it, the curve at our lumbar back here. But it is not for everyone. Depends on how comfortable you are with it, okay? Some patients may benefit from sleeping sideways. Some may benefit from sleeping straight, okay? But if that comforts you, it should be no problem. But then again, the question is, why do you develop the pain in the first place? My concern is that. Okay, all right. Any numbness or weakness over your limbs? Just that back pain. And why? Do you notice anything that you do differently that can actually aggravate the pain?
On that day, I lifted some soil,
Mm.
but I think on that day I did it unergonomically lah.
You did before you learn the correct way of
Yeah,
lifting it. Yes. Okay. So again, when you are, like I mentioned just now, there are stages of cumulative trauma disorder. One is you develop pain at workplace. Second, the pain persists for hours. Third is you develop the pain even at rest. So yours is stage 3. So again, why? Why you develop the pain at the first place? So for me, it's all about prevention. Of course, if you have some back pain, I will give you medication. It will subside immediately. But then again, find the root cause. What caused the pain? Okay. All right. Okay.
Hello, doctor.
Hi.
I want to ask you because I have a shoulder pain.
Okay.
So I go to the clinic, see the doctor. Doctor say it's a frozen
Frozen shoulder.
Yeah.
Okay.
So when I lift up my hand, sometimes too over, it will felt like the pain, very pain. Then you say cannot take any medications or injection one.
Can. Okay, we have several treatments. Of course, I don't explain about treatments here because I think it'll be very, very overwhelming for you guys. But for rotator cuff tendinitis, or also known as frozen shoulders, we have steroids, we have analgesics, NSAIDs, we have analgesic balm, analgesic patch. We have a lot of ointment. We have a lot of oral medication. And of course, we have a lot of injections as well. Okay. But what I would like you to do first is not just by saying that, oh, I have rotator cuff tendinitis or frozen shoulder. I would like to do more like X-ray or MRI, check what is the underlying condition or illness, okay? And then if you see a doctor, a medical officer, if you think it is related to your work, whatever you're doing, because of the overreaching that you do repeatedly at work, I suggest that you maybe see an occupational health doctor like me, myself, or any other OH doctors out there. So maybe we need to go back on your work duty. Okay, because for me, again, prevention is very important. But once you have reached the stage 3, where you have the pain even at rest, that is where medical treatment is necessary. Because if not, you won't be able to live your life like a normal person. You won't be able to carry heavy loads. Sometimes some patients is very bad. They can't even comb their hair. It's very painful for them. So that is when treatment is very, very important. Okay, all right.
Okay, we have the last question. Yeah.
Doctor,
And hi.
hello, hi. Doctor, does body alignment services out there can really helps to improve our posture or not?
You mean chiropractic?
Yeah, chiropractic.
Okay, all right. Chiropractic is a non-medicational approach. We have for doctors, we have the conventional approach, medicinal approach, pharmaceutical approach, non-pharmaceutical approach. Okay, all right. So chiropractic is usually is done by a non-practicing medical officer. It's not a doctor, it's not a medical officer. But yes, some patients they really benefit from the chiropractic. But again, before you go for a chiropractic, I will need you to really ensure that your disease is well established first. For example, if you have back pain, make sure you do a really thorough checkup on it. Maknanya, you really do an X-ray. You be examined by a doctor, by a proper doctor first. Okay, and if the doctor say, oh, this is just paravertebral muscle spasm, means that the muscles along your spine, it's not your spine, okay? So you would benefit a lot from the chiropractic. But let's say the doctor suspect, no, that's inflammation of your tendon here, or that's inflammation of your disc here, all right? Then you will need to undergo medical treatment. Then baru you go for chiropractic. Because I've seen patients where they have muscle disorders, sakit-sakit badan, and they go to chiropractic immediately, and it doesn't actually help to relieve the symptoms and actually worsen the condition, and then the patient may end up in surgery. Okay? So for me, it's best that you diagnose your condition properly first. Then only you go for alternative treatment if you're not really happy or not really satisfied, comfortable with the treatment the doctor is giving. You can do it concurrently, no problem. But make sure you know what your diagnosis is first, okay? All right. So that's the
Okay.
end of the question for today. Yes. Okay.
Last one.
Sorry, just want to ask, is it like flat foot like because I'm a flat foot, so will it affect the muscle that we use at our back? Because like it was like naturally I will lean, like use a lot of muscle at one side. That is not what I want to choose to be like this. But this is naturally I will do
Naturally,
something.
like
Yeah. So is it like fat foot will affect this kind of thing?
flat foot is highly related with lower back pain and also plantar fasciitis. Sakit bawah heel that I mentioned just now. Okay. So for flat foot patients, I would recommend that you use a heel out. There are specially designed shoes for flat fit patients. Okay. You can actually go. Have you seen any orthopedic patient doctor before for your flat foot? You have. You have it. Yeah, okay. As long as you use it, it should be okay. All right. Do you develop any back pain currently? Are you seeking any treatment for it currently? Yeah. So the mainline treatment for flat feet and lower back pain is physiotherapy, because that thing is natural. It's from when you are young. So I cannot, or we doctors, we cannot put you on lifetime painkillers. It won't be healthy for you, not good for your kidneys and everything. So I would really recommend physiotherapy. I think they do provide physiotherapy services at GH as well. I think that is quite free, I think. So maybe you can ask a doctor to refer you to GH. They say that you are interested in all this physiotherapy for your flat foot, they can actually help make a letter. But it won't be so fast like when you go to a private doctor. Okay? Okay. No problem.
Okay, thank you everyone for the questions. So I think we can wrap up Q&A session. So before we end, can we take a group photo again on the stage? Everyone come to the stage. Come.有个照片大概有点多，有点啊，就是来 come to the stage. Yes. Yeah. So if you guys still have any questions, you can stay back and ask doctor personally, okay? So let's grab a quick photo, group photo. Come. Let's take a quick photo. And doctor, come to the center here.
在椅子上拍，这样可以哦。How to use iPhone？张凯，他不是有那个
Yeah, here. Come.
防去老师。 Sad. I don't know how to use iPhone. How to on your camera? Oh. You press only, no need swipe.
Oh, look very.
Okay, everyone get ready. Thank you, thank you. Wait, one camera at a time. Make sure all your face can see. 那边会在旁边吗？ your phone has a flash. Sorry, sir. Phone flash on. Tu. Okay. 拍到? Okay, Okay. Are you ready? One. Side. Okay. Phone satu lagi. Which one first? Ini first. Okay. Ni lengtai dulu. Okay. 1, 2, 3. Okay. Okay. Next. Okay. Ni leng loi. 1, 2, 3. Can change pose also one people. Freestyle. Freestyle. Your turn. 来 okay. 1, 2, 3. 来 phone. Business very good today. 可以 zoom 一点吧。okay. No, different reporter. Okay, last one. 1, 2, 3. When the moment 3, I want so serious. Okay, Kat, you want to take any video? No, all good. Thank you, everyone. Come.
Okay, thank you, everyone. Thank you.
你知道 I don't know whose phone is who. Who pass us the phone? Please pass us back. Okay, thank you. Thank you, everyone, for coming. Thank you for your time. Thank you. If you would like to consult the doctor personally, you may stay back. Thank you, everyone. Nak selfie pun boleh. Dia cakap sendiri dia tak mau bagi. You orang bagi, I tolong you gambar. Cepat, pergi.
Tapi itu foto sudah print out.
Sudah.
Oh, dah. Kosong.
Tak, dia nampak kosong. Bagi. The photo. Ni Doda bagi, I tolong foto. Ni foto kan? Ni dia foto. Bye, Oni. Bye, Oni. Tak cakap pasal Melayu susah.
Ada color dia so.
Tak apa, later you WhatsApp her the